Alright, so we're just going to take a look at some of the Y raise variations or arms overhead variations and just take a look at what the scapula does and how it relates to some of the presentations of the thoracic spine and just some considerations that you may want to make with this particular task or exercise. Myself, I do have a little bit more of a flatter thoracic spine, a little bit more extension based, the upper thoracic region. So something you can see here, obviously we're looking for upward rotation, posterior tilt of the scap, but depending on the variation, you may notice a lot of athletes and a lot of athletes or clients will extend right at the lower border of the inferior scap, so around T7, T8 there, where they get a lot of low back or mid back extension happening there as opposed to true posterior tilting of the scapula. So we just want to make sure that the scap is moving as well too. We can expect some extension in the thoracic region, but if the person has a flatter T-spine, they're probably already in a state of thoracic extension at that point in time. So we don't want to be driving them further into extension at that point. So just running through a few reps here, what we'll see is we'll just look for different variations in how that changes things. So obviously, if we were using a weight in that scenario too with those raises, an athlete may be more predisposed for extending at that T7 level as opposed to using their shoulder blade with upward rotation, moving around the thorax and getting a posterior tilt to happen. They may favor a strategy of extension in the thoracic spine. So what we may have to do is regress them to the wall where they just get a little bit of assist. Now, you can certainly just slide up and down the wall without having that lift-off component there, but that lift-off component gets us through full shoulder overhead flexion. And what you may notice is that again, people at that T7 area may start to extend to the thoracic spine. Again, being mindful of what the scapula is doing is useful with this activity as well too. But just going on the thoracic spine with these different versions, what I want to get into is how position can change that. So if we go down to the elbows, you can see that it's a lot harder for me to extend at this T7 level just by being on my elbows when performing this raise activity, even with one arm too. So it's more noticeably, you're able to feel that activity in your abs as opposed to in the low back around the T7 area, and you can get true scapula activation as well if you want to consider it that with this Y raise, where it's kind of that low trap exercise that we would all hope to be achieving out of it. Now, when you go into this more typical all fours position, you're going to notice these flatter T-spines individuals struggling with being able to maintain scap on T-spine. So you'll notice some of this inferior or medial border prominence on the opposite limb hand. So in this left side, you can see the medial border there becoming a little bit more prominent. I have to work a lot harder to really push my sternum up towards the ceiling and feel my abs a lot more engaged. Right there you can see that's a much better position when performing this activity. Scap is sitting a lot more flush on the thoracic spine. Have to work a lot harder in that position than say when I was on my elbows. That position, more proprioception, less gravity that you got to deal with, just the different components of altering position can put the thoracic spine and the scapula in better positions depending on the individual. Now you can also change the implement that you use. So I see a lot of people perform these Y raises on stability balls as well, or on the table. Now if you perform it on a stability ball, I prefer the stability ball being right at the level of the sternum. The reason why is that pressure from the stability ball is going to give a upward pressure of the thoracic spine and push the sternum back towards the posterior ribs back towards the scapula. So the scap on thoracic spine is going to be a lot more congruent there in matching if you put the ball more at the sternum level when performing these Y raises. Now if you do two hands, you are going to bias someone to a little bit more extension as opposed to just going with one arm. And with myself there, I would like to see my elbow actually stay a little bit straighter when performing that activity as well too. But the purpose of it is, again, where the ball is placed, so it gives it a little bit of assist. Now, where I see most people placing it is right at the belly button, and what that leads to is just more like a back extension exercise, so that, again, it drives more thoracic extension right at that T8 level, which someone with a flatter T-spine, we're going to want to stay away from something like that because they're already in that extended state. And it really doesn't matter if you perform it bilateral or unilateral, you're going to get that same effect if you put the ball right at the waist. Same kind of thing with the table is a lot of times the table, just laying flat on their stomach, just automatically extends somebody at the back and at that T8 level. So if you're going to give them support, I'd prefer using a stability ball right at the sternum to give that upward pressure to push the thoracic spine back towards the scapula to kind of sit the scap on better congruency with the posterior rib cage.